So thank you for that. Also, too, let's see, regarding your issue with your peripheral vascular, you mentioned that you did see some varicose veins that were on the left inner leg, and we'll address that issue, but no current problem with blood flow circulation at all. Musculoskeletal, any muscle or joint pain or cramps that you're having now? Any joint stiffness in your knees or joints at all? History of arthritis, swelling of the joints, any type of gout, swelling or redness of the joints, tenderness to touch, any type of limitation with your movement, you're able to move okay with your joints, no disc problems, no back problems. No? Okay. Back problems? Where's it hurting your back?
Like in the lower part.
Is it the lower part when you bend your back, your sacrum area when you bend it? That area there, up higher?
I think it's like the lower part.
So here's my lower part here on me. So here's my sacrum going across here where I bend the back.
No, it's up higher.
And then up higher here. Your lumbar area here.
Yeah.
Your lumbar.
Yeah.
How often do you have lumbar pain?
Once or twice a week.
We'll make a note about that to speak about that further. Twice weekly. And then on a scale of 1 to 10, 10 being the most pain, 1 being least amount of pain.
6.
About a 6 out of 10. That's pretty high. So we'll see about that. Any heavy lifting that you've done, any type of moving of furniture, pick up any groceries or packages that could have exacerbated that, made it worse at all. How long have you had that pain to your lower back, your lumbar area?
It's been this winter. I've had problems with
winter time here. Okay, winter is when it started, the winter, and then it would happen twice a week or once a week, you think, or twice a week pain, definitely. 2 times weekly. Is anything makes it better or at all?
Aspirin and Aleve.
Aspirin and Aleve makes it better. Your aspirin is 325 milligrams, or is it 500 milligrams extra strength?
Extra strength. Yeah.
Extra strength aspirin comes in 325. You're taking 1 or 2 aspirin?
1.
Okay. Because it's a bleeding tendency. You have to be careful of aspirin for bleeding. And then Aleve. Are you taking 200?
Excedrin.
Oh, it's Excedrin you're taking as an aspirin. Okay, thank you for telling me. Okay. So we need to look at that further regarding that pain to your back. Okay. So let's see. Any dizziness at all? Syncope, collapse, falling down, seizures, any weakness, paralysis, stiffness, stroke, numbness or tingling, any type of tremors or tics, any type of involuntary movements on their own. Can you put both your arms straight off of me like this, straight, and stick your tongue out at me? Na, 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 na. Okay, thank you kindly. So,
what does that do?
See if you have any tremors or shakes.
Oh.
And any type of coordination problems.
One doctor had me doing this. He had me standing up.
To your nose.
I think you do it. Yeah, my nose.
To your nose.
And
I was trying to see about your coordination. Yeah, coordination problems. So, let's see. No memory disorders. No any mood changes at all. Let's take a look here. Any type of mental disorders at all? Hallucinations, seeing things. Delusions, hearing things. Okay. Let's see. History of anemia, low blood, low hemoglobin, blood loss. Any easy bleeding at all, or easy bruising at all? Any past blood transfusions or reactions? Type of lymph nodes? Last couple of questions here. Any exposure to any toxic agents or radiation at all, or chemotherapy? Okay. Any type of heat or cold intolerance? Do you get hot a lot? Do you get cold a lot? Hot a lot? Heat, hot a lot. How often do you get hot a lot? So in a week's time, you get hot a lot. How often? All of a sudden you just get hot. Sometimes it's deal with blood pressure, but yeah, we need to look at everything. So hot often. We got to find out about that hot often. The last time you had a thyroid test was okay. Thyroid exam, take some blood from you.
I never had a thyroid
Okay,
test.
all right. So they usually do blood thyroid sometimes, so we'll just check that out.
Checked it.
Thyroid, we check it out, and then notation here. We're going to see about this hotness. So when did this hotness start? This comes all of a sudden, and when did it start?
It happens a lot when I'm walking. Like if Billy and I go to the grocery store.
Just normal grocery store walking.
If I'm wearing my coat, I
wear
get
your coat.
hot.
You get a coat when you coat. In the wintertime, you get hot.
I have to take my coat off. I think it might be hot flashes.
Hot flash with question mark. We'll look further at that to see about your labs. Probably need to check and see about your estrogen, progesterone, and everything. Look at some labs for you too. Thank you for telling me. We'll look further with that. And then, are you thirsty a lot? Are you hungry a lot?
Sometimes maybe once a month I get hungry.
One time hungry, and they've done some workup in the past for you regarding checking blood sugars too. No problem with your blood sugars. Good. Okay, we'll take a look and see. Checking all these thyroid and everything else out as well. Do you sweat often? Sweating? Never sweat. Almost done. No thyroid problems in the past. You said no hormone problems. No currently. You said no hormone replacement right now. Estrogen, progesterone. You said that. And no abnormal hair distribution. Hair other places where it should be other than any places. Any hair growth anywhere else other than your hair on your head. No, here. And lastly, last question is dealing with any nervousness often, any anxiety, any depression at all, any memory changes or memory loss, being forgetful, any suicide attempts, trying to hurt yourself or hurt others, any history of any type of mental illness in your family. Okay. Well, Miss Joanne, you have been exceptionally patient, and I am truly so grateful to serve you in this capacity as your provider. What we'll do, I like to look at some things further, more deftly, do some research, and then possibly we can schedule an appointment. That's okay for next week or week after next with your availability, and find out for follow-up how we can streamline and find out further blood work or necessary treatments for you, either diagnostic test or otherwise, to define your health issues that were mentioned today. I also like to say thank you so much for sharing with me about your health issues, and I'm going to do my very best to work with myself and other colleagues to offer you the best care to find out the definitive cause and problems of your health issues. Thank you so much.
Thank you.
Thank you. Have a wonderful day.
Thanks.
You can go in the front desk then and schedule your next appointment for follow-up, please.
Okay.
Thank you. Bye now.
Bye-bye.